In a world overtaken by exponential population growth at a time characterized by a decline in life expectancy, the gift of life often comes with the good, the bad, and the unhealthy. Health policies in Nigeria in the last 60 years have undergone tremendous evolution without the quality in place to advance the health status of Nigerians. For more than a decade, the Boko Haram insurgency in the northeastern part of Nigeria has overwhelmingly implicated negatively on development, especially in the health sector. And here in Borno State, finding a solution starts with asking the tough questions.
How far are you willing to go to ensure that poverty is totally eradicated, and when it's eradicated, the people are also empowered to sustain themselves?
Thank you. Barely a year and 6 months into his administration as governor, Professor Babagana Umara Zulum is working with a long-term strategic framework to ensure that health institutions are strong, infrastructure gets upgraded, and impact is formidable.
You have to be very careful. One thing in Nigeria is that we are just playing politics.
While most leaders try to tackle public health challenges in the country as if it's rocket science, Professor Zulum is simply focused on the basics.
We decided to strengthen the primary health care system, the universal health coverage. Under the primary health care policy of the primary health care, each and every ward must have one health center. And then we are also trying to ensure that all the health centers are brought under one roof. We have what we call Seattle Declaration. The governors have been to USA. We have discussed a lot of things with Bill Gates Foundation and Dangote. And we have taken far-reaching recommendations. Among the recommendations is for us to strengthen the primary health care. There is pressure on our secondary health facilities. Why? Because the primary health facilities are not functioning very well. And that has motivated this administration. From inception to date, we built close to about 60 primary health care centers. And believe me sincerely, you have seen them. Yes. Some of them are even better than tertiary health facilities. They are better than comprehensive health centers.
It's a typical weekend in the city of Maiduguri, Borno State. The skies are clear, the weather is sunny, and life here is just the way it should be in a state dubbed the home of peace. TVC News is out to verify the effectiveness of primary health care in the state. Our first point of call is the Abaganaram Primary Health Care Center, and this is what we met on ground. In fulfilling its promise to improve the health sector, the Borno State government, under the leadership of Professor Babagana Umara Zulum, is upgrading this primary healthcare center to a hospital. So, once inaugurated, this place transforms from this compound to this infrastructure.
Sense of policy direction with regards to health.
I had a chat with Dr. Mohammed Guluze, Permanent Secretary, Ministry of Health, Borno State. He is among public officials helping to implement the state government's policy in the health sector at a time when many across the state remain internally displaced.
The policy of government in the health sector as it relates to the general population is that all the internally displaced persons are treated free in all our health facilities. So, but this is a lot of burden on the government. So in trying to ensure that everyone has access to health sector, health services in the state, the government established the contributory healthcare management agency, which is an equivalence of health insurance, national health insurance at the federal level. There is a trend that His Excellency met on ground, and that is very bad indices for the maternal and child health in the state. He wants to reverse that trend, and he has started that by giving all mothers free health care.
And with the world grappling to contain the COVID-19 pandemic, staff training has become a regular activity carried out by the Borno State Ministry of Health.
Recall that the Borno State is not an exception. There is a global pandemic of COVID-19 all over the world, and Borno State has put, under his leadership, has put in a lot of effort to ensure that this disease is combated. And that culminated into, because of the support, culminated into the disease being contained within reasonable statistics in the state. We have a number of treatment centers. The surveillance services is ongoing. Testing is intensified. Contact tracing is also intensified, and a lot of work is being done to ensure that this is controlled. And this could not have been done without adequate funding from the government.
The Borno State Hospital Management Board was established by an Act of Parliament. Chairman of the board, Professor Ara Balaji, says the state government is committed to ensuring healthcare delivery gets to the people despite the level of insecurity in parts of the state.
The Hospital Management Board oversees 41 hospitals in the state, out of which we have functional 22, partially functional 9, 7 are non-functional, and 3 are ready to be commissioned by His Excellency. The others, especially in northern Borno, unfortunately, because of the insecurity, we have challenges, and therefore those facilities are not functional. But again, most of the communities there are within the town. So again, along that way, there is a synergy between the primary healthcare, which is directly under the Hospital Management Board, and the Primary Healthcare Development Agency, where the primary healthcare, we have a synergy, and therefore we support them in ensuring that these services are also covered by our personnel. Again, to motivate the staff, health personnel in the state. There are some remuneration coming up, and we're also working with other donor agencies, especially for the doctors and other healthcare personnel in the rural community. There is now what is called rural allowance that we have to pay to encourage them to stay also in the community, rural community. We work hand in hand with the non-governmental organization, and even now, as it were, even the more or less not inaccessible, so to say, but difficult terrains, we had also arranged with the NGOs to actually transport our staff using the helicopters and choppers, like in the northern Borno, Damasak, Mongono. In a weekly basis, we have slot of getting our personnel taken to the facilities, give services, and from time to time we also change them with the others. So we're working hand in hand with the non-governmental organizations to render services. But also, the government is also doing our best. In fact, there are some facilities now, like in Marte, for instance. They have opened the place, Baga and so on and so forth. So we are also ensuring that those people, like you go to in Goza, for instance, and Kirawa and so on and so forth, we ensure that wherever is accessible, we ensure that services are rendered to the needy people in this community.
You may have heard how members of the Nigerian political class religiously go on medical tourism abroad because of the facilities available in those developed countries. If recent developments are anything to go by, that trend is set to end in Borno State. Based on what I've been told about what Governor Zulum is doing in the health sector, I visited the State Specialist Hospital in Maiduguri to see things for myself. My guest and tour guide for today is Dr. Ahmed Laraba Bello, Medical Director, State Specialist Hospital, Borno.
Tell us how government, the efforts of government to ensure that this place is one of the top places when you talk about specialist hospitals as far as Nigeria is concerned.
Let me start with the radio diagnostic. Our radio diagnostic will have all cutting-edge equipment that you can think of. We'll have the latest MRI machine, CT, mammography, our scanning machine, our X-ray machine. They're all digital, and it can give you whatever that you want.
Brain, abdomen, shoulder joint, any musculoskeletal problem can be treated.
Government has also done a lot in making sure that the patient in Borno did not suffer, more especially, kidney disease is very rampant. And government is doing dialysis free. Everything is being supported by government. So nearly every month we run more than 200 to 300 suction for a patient in this facility, and patient is not paying one kobo for the service.
Today I'm in my 30th dialysis here, and absolutely is free here. To be honest, it's free. There is no any charges. The staffs are very helpful. We are like family here. They are cooperating, and they are even working at times, extra times, just for our own benefit.
At the time this boy came, his name is Gwamna Isa Abu Bakr. When he came, he was unconscious, generalized edema all over. He had few sessions of dialysis, and now he has improved. Now he can identify the person, and he can even walk by himself.
If you go to our theater, we have the cutting equipment in the theater, and our intensive care too. We have all the things that you need for any patient that has difficulty that you want to make him to come back to life. In terms of service, the hospital is doing a lot to make sure that we meet all the demand of the patients. Our A&E is 24 hours, and we have our GOPD that run from morning to night. Then later A&E will continue. Government recently has introduced prematernal to people of Borno State. So patients are getting free CS in this our facility. Patients with ruptured uterus or ectopic pregnancy, we are all giving it free. So if you come to pediatrics too, we have a lot of patients in pediatrics. We have a complex that will cater for all admission. Then our lab, we run a lot of tests in the lab. We do even hormonal assay. Before we usually send it to Lagos, but now we don't send our specimen to Lagos. We run it here, we have the machine. And our histopathology, the equipment that we have in our histopathology, we can rough with anybody in the world. We have nearly all the things that you needed for you to run histopathology. Right now, before we don't have amenity ward, so the hospital has already has amenity ward that almost about to be commissioned. We are waiting for any time to be commissioned. The world is changing, so we too have to change. You know, you cannot do without computer these days. So now we have also opened an ICT center that we want to start training our staff. You know, the hospital is big. Monitoring is a big challenge. So most of the time we have to use CCTV camera to monitor our activity. At least even at home, all the key management staff have the software in their own handset that even at home you can see what is going on in the hospital, and then you can call and question people. Our pharmacy too have it has been renovated. In terms of security challenge, before thieves used to climb the wall, or now are put back wire complete around in the hospital. So, and in terms of lights, our light is 24 hours. All two have been maintaining 24-hour light. Anytime if NEPA should take it, our generator will be on. I think we'll have about roughly we'll have two 800 kVA. 500 kVA, we have 250 kVA and about 100 kVA, all functional in the hospital. We have a dedicated generator for kidney center. We have a dedicated generator for mortuary, and then 200 kVA dedicated generator for MRI. You know, if MRI cannot do without light, so most of the time the MRI is on light 24 hours. We don't put MRI machine on NEPA because we don't want failure. So it's on 24-hour generator. We have 200 kVA. One will work during the day and the another one will work in the night. This is how we have been managing, and the government is supporting us with diesel. The government is also supporting the hospital with regular overhead costs. So I think that one too is helping us a lot to do most of the little repairs, buying of cleaning materials. You know, it's not easy. And yes, and now even though the price of most of the things have changed, but I will see that even though the government too knows that if there is any change, they will also try to adjust in whatever that they are doing. I think essentially we are doing training of house officers in this place. I think we have 24 house officers, even though the government is trying to look for more space. That is, government is trying to propose to increase it to 60, so that not only this hospital, even the other hospital too can have some house officers. We have a physiotherapy unit that take care of the patient that need the service. So then our medical information too, even though it's in the process, we want to make it to become computerized, but we are doing it gradually, you know. One cannot do everything at a go, so it's in the process. That's why we have a training ITC center for training of all our staff. Once all of them get trained, at least even the doctors and pharmacy, it will be there.
To meet the growing demand for more medical personnel, consultants at the University of Maiduguri Teaching Hospital are regularly engaged here.
State government is really doing well by engaging us to come and complement the services in the state specialist hospital. Urological diseases are very common in this environment, and we see a lot of patients in the urology clinic. And the state specialist hospital has done well in terms of getting equipment. Urology is one specialty where endoscopic surgery has gone far, and the hospital are really trying. Some endoscopic instruments have been procured, and they are also trying to get more, and very soon some of the urological surgeries will be done without cutting the patient. So I really commend the effort of the state government and also the management of the state specialist hospital.
ONG has gotten accreditation, and effort is on with the state to also accredit the surgery department. And for them to have the accreditation, they needed to have senior people in the profession, which presently they don't have enough. That is why they've engaged our services, and we do visit to help in training the house officers and the medical officers who, when the accreditation, they will start the residency training program in earnest.
So again, what I did was that I recruited 500 health personnel. That means what I want to ensure is that I want to ensure that we have achieved the minimum threshold requirement in terms of staffing. The more we are getting right in terms of primary health care development, the more we shall be reducing the pressure on the secondary health facilities, and the more people should be having access to healthcare facility.
Government has done a lot, but you know, as a human being, we continue to request for more and more. We want government to improve in terms of manpower, because the patient load is very heavy. If there is improvement in manpower, I think it will make life easy for the patients. Yes, so we want them to look into that direction.
In order to boost the personnel, of recent, His Excellency has also, asked the board to recruit new nursing, both nurses and midwives, about 108. He has also, we have recruited 145 retired nurses, general nurses, and 45 specialized nurses to boost the human resources in the state for effective healthcare delivery in the state. Again, also doctors are not left out. We have also employed 18 doctors. Currently, now, he has also given us go-ahead to employ another 150 healthcare in all that are cut across all the cadre.
Knowing that development is impossible without peace, Governor Zulum is going the extra mile to safeguard the lives of the people, creating a healthy and wealthy Borno state, one person at a time.